Hello, everybody. I'm Jeff. I'm a wizard. And today I want to talk quickly about the negative self talk in your head, the rumination, constant worrying, or the negative dialogues in our head, how to handle that. Some pro tips from me, because as you may know or not, I am a doctor and I have worked a little bit, like around 4 to 5 years, in the field of psychiatry. So I've seen a lot of patients who deal with this problem. As me myself, I am a very good like experience expert. I've been combating this for a long time. Now I also have ADD, ADHD, definitely on that spectrum. I myself don't really agree with that name. It's first of all, name makes no sense. Attention deficit, far from the problem. There's a lot of attention and a lot of focus. I see it more as a dopamine problem in a general theory. Like there's this new theory for autism, and it has a really weird word that you can only say in English. Salience. Anyways, it has to do with dopamine. Now imagine these little animals in Africa. They're called these little from Timon and Pumbaa. I bring it up every time, and every time I forget the word. Meerkats? I don't know. We'll edit something in. These little things, like they're known for standing upright and staring in the distance, like being on guard, or I don't know what they do. They usually stand on a road there, and they're hyper-focused. They're hyper-focused. Now, these animals, at that moment, they're full of dopamine. They're just one and all, zoom, laser, focus, right? And when they rest, the dopamine drops a lot. So they have two modes. And the same goes for, I think, humans, us. We have two sort of general modes you could consider. It's sort of the active mode, being on guard mode. Let's say there's an intruder, or you need to fight, or there's a danger. Your body goes in a hyper-awareness state, right? Okay. And then you have the opposite. You have a relaxation mode, and then you can go from your zoom, you could say, from hyper-focus to everything is open. Your lens opens up. So you, and then you can relax, right? Let's just leave it at that. Okay. So what I more believe is that people, because of circumstances, because of upbringing, could be a cultural thing, even maybe. I personally think Catholicism had a lot to do with a lot of the guilt and shame spirals that a lot of people find themselves in, but that's my experience. And because you don't even have to be a Catholic or a Christian to suffer from these effects, because of so many generations who have been, like, the culture has adapted to religion, in some places. So you don't even have to be believing in the underlying dogmas, but you're still living according to their, like, beliefs, right? So it seeped into the actual everyday habits and the way we handle each other, the way our belief systems, our law systems, everything. It's like it's sort of seeped into it, right? So even if you're not a believer, or if you're an atheist or an agnost, you could still suffer from these effects, because it's become cultural, and your mom did it, and your dad did it, and your grandparents did it, right? So it's a normal, and it becomes hard to see outside of that. Like, what is the alternative? It seems like there is no alternative. Sorry, sidetrack, moving back to the main focus. The dopamine problem. So I believe that people, during circumstances, when you're young, let's say you have a difficult upbringing, or let's say you grow up in a war zone, or somewhere very difficult when you're young, right? So there's what children do, it's like built in. When parents are in danger, or when parents are faulty or absent, children go into this program of they protect the parents first, because for a child, the parent is life. If the parent dies, the child dies. So when the mother or something would become in danger or sick, the child will sacrifice itself. in order to, so the mother survives. Because without the mother, the child is as good as dead, right? So, and for a child, it's also built in that any separation is also too dangerous. So they will stay near people when there's no alternative, even when those people are bad, even when these people hit them, even when these people don't treat them right. Children will tend to stay because it's so built in. It's like solitude is death. That's like dying. That feels like dying. That's why for, even in adulthood, for many people, going out of dysfunctional relationships feels like dying. It's actually dying. Your body goes into panic, okay? And that's built in. That's built in. That's something you just need to become aware of, first of all, right? When you become aware of these things, when they happen, the impact is not so great when you can say, when, like, let's say you do get into that situation, you go into the panic mode, when you can then sort of say to yourself, I get the alarm, I hear you. The effect is not so great. Usually we lose control, we flip out, right? Or we become crazy when we ignore the alarm, and we tend to push it aside, and then it becomes so huge, or it explodes, right? And it doesn't have to explode when you can just recognize it on time. That's all it needs to do. When you can tell your body, I hear your alarm, turn it off now. Usually that's all you need to do, but we get so far in ignoring these alarms, or we become so used in living with these alarms, that it's like your subconscious has to go around in roundabout ways to get you to notice it, right? But remember, like, these signals can be turned off because it's like a memory, almost. It won't turn off until you look at it. It's very peculiar how well our emotional body remembers. It's like you can reason all you want, it will still come up. So that's incredible, almost. But that's where also a lot of the dysfunction comes from, because as much as we want to adapt or believe the lie or whatever, and are fine with it, it's like the truth can be erased, and that's logical, because it's like if you would, it's like if you carve a tree, that scar is always there. So you will always see it. It will heal. It will grow over it. Moss will grow over it. Maybe another branch will appear. You will always see it. So goes the same for us, right? Okay. So when you grow up in a surrounding that is very difficult, and as a child you have to go into this constant state of sacrifice or vigilance, and usually that's where I believe it comes from. When in your childhood you're not in a safe surrounding, something is off, so you go into, as a child you want to fix it. The children feel way better that something is off than the parents, because they've been conditioned, they've become desensitized almost. But children, they grow up with the normal paradigms inside themselves, so when that clashes with the world, their alarms go off, and they become hypervigilant. Their dopamine is constantly up. They're constantly in this guard state, looking out, right? Now, the neuroplasticity is very real. It means that whatever you train, your brain adapts to it, right? So a task you do every day, that part in your brain that does that needs to do that, grows. Your brain adapts to it, right? And that's also a very important side note, because you need to understand how your brain works, because let's say you can use that to your default. You could use this to harm yourself, because if every day you look in the mirror and you try to look at what is wrong about your face, or ugly, or wrong with your nose, I always use the nose as the example, then you train your brain, that part of your brain that looks at ugly things, or that compares itself to other people, or that just even the part of your brain that focuses on your nose, that wants to see your nose better, right? That wants to see it more detailed, grows. So what you're doing is you're growing that part of your brain every day to look at the ugly things and to enlarge your nose and to give it a better example of that. So you're actually training your brain to see ugly and to see yourself as ugly. And it's more like you're training your brain to like take that part of yourself and enlarge it. It's like you're saying, computer, show me these parts and expand, analyze. I want to see more of this. Show me more how my nose is ugly. Let's analyze this more. And it's like your computer becomes better at this, right? That's important because you need to recognize this. So you can also recognize that, like, hey, there is maybe this little problem, but I've zoomed in on it incredibly, right? And I can zoom out and I can train my brain to see nice things. And you can actually ask this. And this is a trick that I really, it sounds silly and it sounds like it shouldn't work, but it really does. Just ask yourself out loud, or ask your brain, today, help me see examples why I'm attractive, or help me see examples of good things that are happening around me. And your brain will. You just need to ask. Or same as like, or body or brain, help me get up on 8 a.m. or 7 a.m. or help me get up on time, or help me remember my dreams, help me fall asleep fast, help me feel more relaxed today. It all works. You just need to keep asking and keep retraining your brain. And it's most of that is recognizing that you've been training your brain to do something else. You've been training your brain to focus on pains in your body. You've been constantly telling it like, where is that pain? Oh my God, that discomfort. I need to do something about this discomfort. This is very, like, you're training your brain to notice how uncomfortable you are at every second. And you're gonna find more examples of that because you're basically asking your brain, look for discomfort, right? It's very important. Okay, so moving from this my theory of sort of that ADHD or any kind of over worrying or over like using this computer too much and having this constant stream of negativity, maybe. I often see that as coming more from a situation once where you trained your brain to do this a long time ago. And another thing that I feel is very important to understand, because this is something that helped me personally move out of depression a great deal, or deal with it a lot better, and help, I feel, a lot of patients deal with their thoughts, especially in the moment, right? I have no real experience or I don't have a lot of experience to say that, like, look, what I'm except for myself, I'm my own greatest example, but what works for me doesn't work for everybody else, so I'm very well aware of that. So I don't know what helps in the long term, right? I think that's very personal. I think every person in his own case should find out what works for him or herself. I think that's very important, because what modern psychiatry or psychology tries to do is it tries to explain everybody at the same time. And it gets further away from the problem, because the problem is very individual. You have depression-like symptoms maybe, or anxiety, because you once adapted to a situation that required you to have this kind of mindset, right? You were once in a bad situation, or you were taught bad things that now you're stuck with, right? It's not your fault. You're nothing wrong with you. You're not broken in essence, right? You have a normal reaction to a shitty situation maybe, or not even a shitty situation. You had a normal reaction to a situation. You just need to understand it most of all to deal with it, right? And recognize that you are not the thoughts in your brain, okay? And that's that second important thing I wanted to say is that you need to, this is what I do. I wake up and I need an hour, maybe two, to get out of my autopilot thoughts. It's very negative. I'm focusing on problems. I'm focusing on the feeling bad. I'm focusing on feeling tired. And I go to anger a lot of the times. And a lot of my rumination or my anxiety revolves around me sort of, I can't turn off this computer thinking constantly like, maybe I should be doing this. Maybe that's the key to my answers. Maybe I missed it. Maybe I missed an opportunity there. Maybe I misunderstood it there. And it's constantly looking at the past, seeing where I did wrong, trying to correct, or trying to see, like, trying to get me out of the situation, right? So my anxiety turns up and says like, oh, I see danger. So my brain goes to try to fix it. But what I'm learning right now is turning that off. It's like, you don't need to fix anything. Everything is fine. I'm good. I can sleep. I can rest. I don't need to be fighting. But my brain is just on autopilot. Takes me a while to recognize that every day, but when I do, what I've learned is, first of all, you are not your thoughts. So what my thoughts are doing is they're sort of like, I have most of all this anxiety, and my brain is just sort of giving autopilot. It's sort of like, oh, anxiety, let's go. Think, like, fix the problem. Search, analyze. So I have this, my brain is so trained on looking for problems, right? Which is really damaging me right now because good things come at me. I hyper focus on one or two things. I see danger, and what my brain even does, it paints a picture over it that's not even the truth, to sort of protect myself, because maybe I can't deal with the possible danger of something right now, so I'd rather not even get close to it, right? So that's how dangerous it feels for me, but I might be missing out on a lot of good things. I hope you hear me. Anyways, big part of that is not judging myself, not starting to blame myself, and just recognizing, oh, I'm doing it again. Like, it's very negative. And I see that as like, okay, it's nothing to do with me. This is not the truth. Most of these things I've gone over with, if when you journal a lot, you take your time to look at these thoughts and say, like, are they truth? Is it real? Is this really what's bothering me? And usually it's not. Usually what you're telling yourself is a distraction, because you'd rather look at a million little problems that you could possibly fix than look at the truth where you're powerless, right? Okay, but it is a lot of power in recognizing that and seeing, like, okay, I did it. I'm in war mode again for like 2 hours. I'm stressing out, and that's okay. It's not my fault, but I'm doing really good, and it's okay. And I know I'm scared, but I'm also fixing it, and I'm doing the best I can, right? Keep telling yourself that. And these talks can get very emotional, right? But that's the point. You need to get through that emotion, to get through that autopilot, and to start changing that, because it is not the truth. You are not your thoughts, okay? So if you're depressed or you're struggling with anxiety or any of these things, right? And these thoughts just come up and they come up and they come up, and people tell you, change your thoughts or just think happier. You can't. Stop forcing it. Stop thinking you can't. These thoughts are automatic, and these thoughts come automatic on a feeling you're having, right? A lot of this is trained. So a lot of this involves retraining, recognizing, but most of all, it's about an alarm is going off, and you recognize that by, okay, looking at the thoughts from a third person point of view, from the outside. Okay, oh, look at all these worries. Oh, worries, look, worries there again. Oh, look, and I'm zooming in on money again. Like, oh my God, look at all, I'm very scared, right? So take a second, step back, look at it, okay, these are all worries. What is the alarm trying to tell me? What is it trying to get me to do? It's trying to get me to do something about my money situation, do something about this. What is underneath that? Like a lot of anxiety, a lot of maybe feeling like not worthy, like not, like, could be anything. It's very personal. But you need to dig, and you need to keep digging, and you need to keep interrupting these automatic streams, because you're not your thoughts, you can't control them. It's more like, and I've seen this in myself with depression so well, and also with like experimenting with drugs, that's why drugs helped me at one point, because it was such a good example where I saw, oh my God, because the chemicals change in my body, my thoughts change. I took these drugs. Mostly I had it with, but like, because I have this ADHD thing, right? So like these chemicals also affect me differently. So I'm very careful at like sharing what drugs gave me what effect. But it's mostly, I got examples of where my body became in another configuration, and I was accessing different parts of my brain. And suddenly I saw, oh my God, so these little chemicals rise and my thoughts change. The actual origin changes, the actual content changes, the feeling around them changes. And then when I get off of the drugs and I go back to my depressed mode, it changes again. It's like I can't, it's automatic. It's just an automatic stream of negative thoughts. And once you start recognizing the loops and the patterns and like, oh my God, I've been around, like I've seen that tree before, you start to get a hold on it, and you start to see like, oh, okay, you need to understand how your brain works. You're not your brain. That's a part of you. That's just a powerful computer you have. But you've been thinking you are your brain, and you've been overusing that computer to fix your situation. And right, usually the situation is fixed by looking at your heart, by feeling. A lot of modern therapies go into that more, like you have EMDR, where they are trying to distract you. They're trying to switch. Also this helps for me, and it's a cool thing, it's a cool trick that I can give anybody else. When you're having this overthinking, worrying, right? Try to pay attention to what side of your brain what side of your field you're looking at. When I'm super worried, I usually am looking right up, right? Through my right eye, sort of up, like I'm looking at something. Imagine, like when you're dreaming like looking at the sky, right way up. So at that moment when I recognize it, okay, I'm worrying, and I'm looking right way up, try to switch that, look to the other side, to the left. And what I then feel is like, as hard as I try, I even can't think these thoughts. It's like I'm forcing my brain to go from active mode to passive mode. And it has something to do with your right side of the brain and the left side of the brain. And these modern therapies, EMDR and other things, it's like the old things where they swing the pendulum, like in hypnosis, right? Like you're following this with your eyes. So what you're kind of doing is you're interrupting your, I think, automatic thought stream. And what they usually ask you to do is you focus on this, and then they ask you, what are you feeling? And then focus on that feeling. And it's like, it took me a long time to get this when they asked me like, okay, don't think, just feel, and let that be. I didn't get it. First couple of times I was racing in my brain. I was like, what am I supposed to do? Am I supposed to be thinking this? Am I supposed to be looking at this? Am I supposed to be thinking more about this? Am I supposed to be thinking other thoughts? Like remembering other thoughts? What am I supposed to do? And after a couple of times I realized, oh, I'm supposed to do nothing. Just listen. Took me a while. Same with mindfulness. Took me a couple of because when you're so into this hypervigilant state and you're overthinking all the time, it's your normal, so it becomes super weird to step out of that, and then it becomes more weird when you see yourself that it's like like, don't be surprised at how much your world can change and how much things can change. It's like you're going in and out of the matrix almost when you start realizing this. But the moment you start seeing that you are not your brain, and you start feeling a little bit of relief in this, or you experience the strength of interrupting these thoughts, going straight to the core and listening and feeling, it's the way out. And you feel it and you know it, and it goes up and down. And look, I go back into, because the circumstances are what they are. So don't, that's the last tip I can give you. Don't be so freaking hard on yourself. You're still reacting to things. So let yourself react. Don't expect yourself to, like you can know stuff in theory, but then practicing it, feeling it, it's a whole different thing. And it takes time. And most of all, you're still reacting to circumstances. Maybe you still need to change those circumstances. Maybe you still need to heal. Maybe you still need to grieve. Maybe you still need to grieve about stuff that happened very, very long time ago, okay? Don't be so hard on yourself, okay? Even when you've been doing this for a very long time and you're tired of it, and you think like it's just never gonna stop, or I keep damaging myself or sabotaging myself, and I don't, it's like I don't want to be happy. It's like it takes time. As long as you keep saying the intention, I want to get better, I want to be happier, I want to heal from this, you will. You just need to keep putting one foot in front of the other, and when you stop moving and fall down and lie there for I don't know how long, it doesn't matter. It's okay. Just forgive yourself for reacting normally to something, okay? And remember, the more something hurts, the more you're honoring that something was very important for you. And there's a lot of power in that. So you're not alone. You're not doing as bad as you think you are. Things are not as bad as you think you are. You're not as ugly as you think you are. There is a way out. And you'd be surprised at how things can change and how much miracles can happen when you start following that feeling and let logic rest for a little bit and start. Never the answer is one or both. It's always harmony. Like science or logic never has to rule out your feelings, but the opposite is also true, and that's what you're doing. I need to listen to that again to see if that's logically true, but it made sense. So that was my wildfire explanation. I hope it helps somebody. A friend of mine texted me to ask me about this, and I just got the inspiration to just talk. Hope it helps. Hope my glasses look good. If somebody knows how to clean glasses well, because I can't see a lot. Hello. Have a nice day, and be kind to yourself, please. Thank you. Bye.